Good morning, honorable present here. Myself, Pradeep K, postgraduate, Saveetha College of Physiotherapy, and my co-author is Dr. Ramana K, Associate Professor, Saveetha College of Physiotherapy. So, I'm going to present a topic about a comparative study on manual therapy technique for temporomandibular joint dysfunction in individuals with upper cross syndrome. Introduction. A wide spectrum of disorder affecting the temporomandibular joint and periarticular musculoskeletal tissues of the temporomandibular joint dysfunction. So, it is a common musculoskeletal disorder characterized by pain, restricted jaw movements. So, there is a restriction of opening and closing of the mouth and functional impairment of the joint and surrounding and associated muscles. Okay, so here the most of the symptoms of temporomandibular disorders it will mostly include in pain in the temporal joint bundle. It also refers to the jaw muscles and also the temporomandibular joint. So the patient have difficulty in opening and closing the mouth as well as pain that will refers to the isolation of the face, ears and jaws. So the most common indicator of the temporomandibular joint is a pain. So followed by there is a joint sound like crepitus will happen occurs due to the mandibular dynamics, so opening and closing of the mouth, and also there is a restriction of jaw mobility. So here the muscular imbalance disorder like upper cross syndromes are related to the numerous type of rapid element and also a particularly restricted RM in jaw and forward head posture. So in my study, how these upper cross syndrome is correlated with and affecting the temporal mandibular joint. That is the exact ideology of the study. So now this upper cross syndrome is mainly occurs due to the muscular imbalance in the anterior and posterior aspect of the lower crossing the syndromes. Like anterior aspects of our sternocleidomastoid muscles will prone for the tightness, and also a posterior side will prone trapezius muscle prone for tightness. So here these muscles have a imbalance. So that time these cervical deep neck flexor. So deep neck flexor muscles mostly prone for the weakness. So that will prone for weakness. So this masseter muscle present in the jaw, it will act in the overactiveness. So there is a masseter muscle is overactiveness that will lead to the muscle restriction occurs due to the because of the some myofascial trigger points and all that it will happen over there because of the overactiveness. So due to the deep neck flexors, how these upper cross syndrome will affect over the TMJ cell. So and also the prevalence of upper cross syndrome is associated with mostly 11 to 60% in different population and different age groups. And also these upper cross syndromes have a forward exposure and muscular imbalance around the neck and shoulders. So it will worsen the symptoms. So because of this connection only, we are going to see about how this upper cross syndrome will affect TMJ joint and their joint, and it will both musculoskeletally in their joint and their muscle. Next. The upper cross syndrome is mostly associated with temporal dysfunction. So jaw pain is among the several referred cases linked with this upper cross syndrome, a condition of muscle imbalance. So this forward head posture and mechanical leg problems that we find in the associated complication of this temporal mandibular joints. So in this intervention, we are going with the manual therapy techniques like myofascial release and joint play technique. It is a mobilization techniques. Our common manual therapies used to relieve muscle tightness and improve the joint mobility. In this figure one, we can see about the crossing syndrome. So here, this deep neck flexor will prone for the weakness, and also a posterior side, lower trapezius, serrator anteriors will go for weakness. Posterior side, tight muscles like upper trapezius, levator, scapula will go for tightness, and also in front anterior, these pectoralis muscles will go for the tightness. So that's why these upper cross syndromes affecting the also the shoulder joint. This is a group of muscles affecting here. So that's why it will related with the temporal mandibular joint because of the overactiveness of masseter muscle. So in figure 2, we can see there is a trigger point in the masseter muscle. So here is a present of masseter muscles in red spot also have a trigger points. Review of literature. In this, Eki et al. 2024 conducted a study on relationship of functional limitation disability with clinical symptoms of temperamental disorder. It is a cross-sectional clinical study. In their study, they are known about the patients are examined with pain, MMO, like maximal mouth opening, and joint noises like click, crepitus and all. So they are assessed using the jaw functional limitation scale, that is mostly a functional disability or a functional disabilities was assessed during the temporomandibular joint, and also they are using a TDI, temporomandibular disability index. This study finding demonstrate that clinical symptoms in the temporomandibular patients are directly associated with the functional limitation and impairment. Next, Begum MR 2022 conduct the valuability and reliability of VAS for pain measurement. They are now concluded in the several study, and they are revealed that VAS is the primary outcome measure for to treating and assessing the pain. It's a outcome measure tool only. Next, Arera Valzina et al. So 2020 has a study on the efficacy of manual therapy in temperamental disorder and with the medium and long term effects of pain and mouth opening in the systemic review of meta-analysis concluded that how this manual therapy is mostly helpful for this treating the temperamental dysfunction in resulting in the restriction of maximal mouth opening. So restriction in the jaw mobility. So they are concluding in this study like that how this manual therapy and postural karate exercise like therapeutic exercise and all give a greater improvement shown in their current study. Next, background of the study. So in this background of the study, the temporomandibular joint dysfunction is just basically a musculoskeletal condition marked by the pain, jaw mobility, and functional impairment. It frequently exists in the postural deviation, particularly upper cross syndrome, characterized by forward head posture and rounder shoulder also. Why rounder shoulder means we are already seen about in the upper cross syndrome, there is a tightness and weakness of the opposite muscles group. This postural imbalance places a abnormal mechanical stress on the temperamental pressure. So here we can see that abnormal mechanical stress on the temperamental pressure. These abnormal mechanical stress means due to the weakness of the deep cervical muscles. So it have a overactiveness or overstressing of masseter muscle. So that is we are basically seen here. And also the manual therapy interventions such as myofascial release and joint play techniques are commonly used by physiotherapists to address the muscle tightness and facial restriction and all joint dysfunctions. However, there is a limited comparative evidence evaluating the effectiveness of two approaches individuals suffering from these temporal difference also combined with the upper cross syndrome. So, need of the study. In this need of the study, the incidence of upper cross syndrome and temperamental dysfunction has increased in postural dysfunction, and also it is causing a prolonged forward posture and sedentary lifestyle have become more common for the patients. While there's both joint play technique and myofascial rest techniques is used in the clinical settings. So there is it will have a effective for improving the pain restrictor range of motion and their postural alignment. So and also a functional impairment in this population. So it is mostly in need of the study. We are going to see there is how this upper cross syndrome and temperamental joint is correlated. And this joint play technique and myofascial group release will helpful to treating this population. Aim. So the aim of the study was to compare the effectiveness of myofascial release social joint play technique combined with postural corrective exercise in individuals with TMJ joint dysfunction associated with upper cross. Objectives to evaluate and compare the effectiveness of myofascial release and joint play technique and improve maximum mouth opening and reduce the vascular in patient with TMJ dysfunction, patient with upper cross syndrome. And also second one is to assess and compare the impact of hemaphore and joint play technique and improve the craniovertebral in patient with TMJ dysfunction, upper cross syndrome. Next, to determine the effectiveness of myofascial release and joint play technique in functional disability in patient with temperamental joint dysfunction in patient with upper cross syndrome. Methodology. The study design is an experimental study and the sample size was 104 was selected based on inclusion exclusion criteria. Sampling technique is a simple random sampling technique. Study duration is 4 weeks. In inclusion criteria, the age between 20 to 60 years Both genders were included. All subjects having forward exposure. So there is a outcome measure like CVA, cranial vertical angle. It will reduced or less than the 49 degree only they are included. And also VAS score is about at least 5 out of 10. So MMO is reduced less than 40 we are taking. And presence of TMJ dysfunction and upper prosonum at least more than 3 months. At least 3 months. So next exclusion criteria. Open wound in and around the cervical region, recent trauma to the temporomandibular joint and cervical region, post history of surgery in cervical region and any inflammatory conditions. So participant with disc degeneration and radiating pain to their shoulders and non-cooperative patients. These are we are excluding. Subjects are next intervention. The subjects are divided into the two groups, experimental and control group. In experimental group, we are divided into the 50 will receive a myofascial release therapy with the posture corrective exercise for 4 weeks. So 3 times a week, 40 minutes. This MFR therapy was administered to the specific areas twice for the duration of 90 seconds each. 90 seconds each time. So the muscle groups are muscular, turn up your muscle. Every tight muscles are going to be released with this intervention, and the control group is divided into 52 will be received a joint play technique posture corrective exercise for 4 weeks. This joint mobilization was carried out both anterior and posterior anterior and posterior translation under some medial direction in current investigation. The patient are instructed to open and close their mouth for 10 minutes prior to receiving the manual therapy. So for a total of 7 minutes, the mobilization was carried on 3 sets of 2 minutes each with 30 seconds of break in between, 3 times a week. The therapist selected technique intensity based on the patient tissue resistance. The postural corrective exercise, both groups will receive the postural corrective exercise for 4 weeks. The exercise are first one is stretching the upper trapezius stretch, second one is the pectoralis stretch, sternocleidomastoid stretch, and also active and passive stretching of the jaw by the therapist and also the patients also. Strengthening exercise, chin tuck, scapular retraction, serratus lunge, dip neck flexors. Next, the outcome measures. So primary for this is a primary outcome measure is VAS, MD ruler software, and also a MMO, maximal autonomy. These three is very important for my study. So the VAS is we are this is used to assess the pain levels for the patient, how the pain data levels present with the pain. So we are taking the either VAS score itself. Next is the MD ruler software. It is a on scale goniometer. We will have a it is a open assist software. We will upload. We will have a photograph of the patient in the lateral view, which should be taken and uploaded in the laptop. With this on scale goniometer, will click it on there. So it will detect that how this forwarded posture and will reduced into this 49 degree less than 49 degree, how it will reduce and all it will detect there. So therefore that's why this MB ruler software is used for this cranial vertical angle. Next one is the maximum mouth opening. It is a basic assessment method for temporomandibular joint. So ask patient to open their mouth, and we will take a scale with the placement over the upper and lower incisor and measure with So next one is jaw functional limitation scale. It is a scale that 8 and 20 items form, which is tool used to assess the overall limitations of the mass central system. It will indicate the declining jaw function. Score ranges from 1 to 200. In this figure 3, this ember ruler using CVA. So this is a craniovertebral angle placement of the C7 and ear tragus. So if the patient have reduced reduced cervical flexion. So this is a triangular on-scan goniometer will detect the reduction of forward motion. So and also in figure 4 there is a scale measured with MMO and telling the outcomes. So next one result. So in this result, we can see the pre-test and post-test of the control group. So mean is around 8 and it will be reduced to 2. But experimental group, it will be reduced by 5. So next one is 20. Before that, pre-test 28 of CVA, and for control group for post-test it is 32. But here we'll see about a 28 and 43. So it is improved. So in the same that the MMO of the control group of post one. So 35, but here it is 50. So JFLS also is a post test of control group is 32. Here 20. Okay. Next one, this we will see about the graph. So here see the blue color one is a control group. This is orange one is a experimental group. So in this class we will see before that how it is reduced from control to experiment post test value. CVA is improved. So there is a improvement of forwarded posture. So craniovertebral angle. MMO, there is a increased range of motion of the mouth. Next one is JFLS. It is reduced because we have to declining the mastocytory function to improvements showing. Next discussion part comparison of literature of previous study for interaction and outcome. These upper syndrome, how it is correlated with dysfunction of TMJ, a range of severe TF levels and prolactin program formula discovered. According to the study findings, how myofascial treatment and this therapy combined with corrective exercise both successfully in improving posture and organ pain and functional outcome. In Komal Agmat 2023 result, a study showed that myofascial therapies along with corrective exercise increasing the cervical range motion and reducing the discomfort, functional impairment and improving their posture. So and also this one is a Deepthi Vilaskadu in 2023 evaluating the CV angle used with MB ruler is evaluating the good intra and intra-writer reliability is most valid and reliability itself. Quality also is 2003 the result strongly indicate this how this MMO is very useful for like the placement of three fingers. They are discussed, but I am here used with scales and also we can use with the verniers as calipers also. So Nazim Tolagam as 2024 the studies from the validity related to these JFLS scale. So in discussion for mostly for my study, I am concluded that how this myofascial therapy will shows combined with the posture corrective exercise and treating the patient with these symptoms, it will give a more improvement compared with the joint plate technique. It also shows the improvement, but for my study, this myofascial release group only got the greater improvement. So, in conclusion, but as well on the discussion in conclusion, the passion study, my study concluded that both myofascial and joint plate technique with posture corrective exercise are effective for managing treating the this TMJ dysfunction with upper cross syndrome. The myofascial release shows the improvement in pain levels and improving in the forward posture and improving their maximum mouth opening and jaw functional mass for 4 week period. So myofascial release shows greater improvement in pain reduction and jaw function post alignment TMJ subject associated with these upper syndrome. So the finding of the study indicates totally it will conclude that there is a correlation between the this upper crust syndrome and different region dysfunction. So this is my reference. So thank you.